Hi, everyone. Hope you're all doing well. My presentation is called Getting Closer to God. You'll see why in a moment. So let's get started. My patient, we'll call him Jesus. He's 7 years old. He is a dizzy patient. So referred by primary care. The referral stated 7-year-old male with sensory issues, feeling dizzy for 2 months. Patient feels he is spinning. So he was seen in our office for a hearing and a balance assessment. Typically, it's for adults. We rarely have dizzy children coming in. So it's more geared towards adults, but we do what we can. So he was accompanied by his mother. Um, Mom reported that about 2 months prior to this, he had started to say he was feeling dizzy. She said he would run up to her and say, "Oh, Mom, I'm feeling dizzy. I'm dizzy." When I asked him specifically, what does it feel like? How are you feeling when it happens? He stated he felt like he was getting closer to God. Um, Kind of cute, kind of unnerving, but the motions he was making, it looked like he was kind of almost, he felt like he was floating and going upwards that direction. Um, so he stated that he was spinning only when prompted. The referral said he was spinning, but he never really stated that unless I asked him, do you feel like you're spinning? The patient will cling to mom for a few minutes before going back to doing whatever he was doing, whether it was playing or whatnot. The most recent episode, according to mom, was the day prior and lasted about 5 to 10 minutes. Mom states that there's been an uptick in how often he's been getting dizzy over the last 2 weeks. So here are some other things just to note that I saw in his chart. So in our EMR, we have an active problem list. So you can see that there's vitamin D deficiency. There was an abnormal thyroid function study. He does have an unspecified disruptive impulse control and conduct disorder, as well as seasonal allergies. He does take a daily antihistamine for it, chromosomal anomaly, as well as sleep apnea. I don't know if he uses anything for that. Other things to note, he has been seen in our clinic before. So he did have a history of a speech delay as well as a history of bilateral PE tubes. They are not present as of, I believe, 2021. Follow-up was just as needed. It's open-ended with the ear, nose, and throat doctor. Mom does state that patient does have anxiety. So he did go through a life change about 6 months ago. Mom switched to night shift and it was pretty hard on him in terms of adjusting, and it really kind of changed his bedtime routine. So he's kind of sensitive. Mom called him a mama's boy. So he did have recent congestion that she related to his seasonal allergies. Here is the audio that we did. So ear canals were clear, TMs looked normal or within the norm. Tympanometry, you can see on the right side, I know the system says it's a type B, but I think that looks like a type C to me, just really, really shallow peak. Type A on the left. Pure tones on the left ear, normal. There is an asymmetry at 500 between the left and right bone conduction. And then right, there maybe like a little slight hearing loss there. He has had previous audios before, like I mentioned. I don't have any, unfortunately, but I will say that they demonstrated a conductive hearing loss bilaterally as he was seen for chronic ear infections. So this is a marked improvement compared to previous audios. So word recognition was 100% bilaterally. In terms of the balance assessment, I thought it would be kind of interesting to see how you guys might interpret everything else if I withheld the balance results. So I did do ocular motor screenings. That includes checking for spontaneous nystagmus, doing gaze testing, smooth pursuit, saccades, convergence, past pointing, and then I did Dix-Hallpike. So I want to know, how would you interpret everything else if Dix-Hallpike was negative, or if it was positive? What would change about your diagnosis or running ideas? Otherwise, he is a kid. So do you feel like there are any other referrals to be made to ear, nose, and throat, to primary care? Was there anyone else that you might refer to? So I just want to know your thoughts, and it's kind of a rare thing to see a little dizzy kid. So I'm excited to let you guys know the outcome of all this, and I'm excited to see everything that you have, all your thoughts for me. So if you have any questions, please let me know. But I really appreciate all your time. I hope you guys are doing well. Take care, guys.